So if you are in the second category, this video is for you. In my clinic, we get two types of patients. One who has already decided to get a hair transplant done and have come to just finalize. And then the other who desperately wants to get a hair transplant done, but they have plenty of fear, which is most probably due to myths that they have heard from their friends or the internet. So if you are in the second category, this video is for you. Hi, I am Dr. Dushyanth Kalva, a plastic and cosmetic surgeon practicing at Inform Clinics, Hyderabad. I have been doing hair transplants for the past 10 years. So we have started by doing an FUT method, which is known as the strip method commonly, and then we have progressed on to FUE, and of late we have added a new technology, which is a robotic technology, to enhance the results. With the robotic technology, now we are able to provide a much enhanced results with much less downtime. If still this doesn't convince you for a hair transplant, in this video I am going to discuss the 4 common myths that I come across when the patients talk to me, and this we are going to clear in this video. So the 4 myths I am talking about are actually 4 doubts that patients express. One is the pain during the procedure, second, scarring from the procedure, third, the naturalness of the result or the lack of it, and 4, the speed at which they will get a result. Myth number 1, the pain. People think that a hair transplant or a robotic hair transplant now is a very painful procedure. But let me tell you, a procedure that is done by a plastic surgeon who is experienced in hair transplant is never going to be painful, because as plastic surgeons we know where the nerves lie under the skin, and these nerves, when they are blocked with a good local anesthetic, can produce a very good numbing effect. And believe me, forget about pain, there is not even going to be normal sensation during the procedure. That means there is no sensation whatsoever in that skin during the time of the procedure. So pain is not a problem provided a good nerve block or a local anesthetic is being given. Myth number 2, robotic hair transplant produces a lot of scarring. So in my experience with the robotic hair transplant, it actually produces less scarring, because we extract the grafts in a much less traumatic way, resulting in a tiny dot scar on the back of your head. These dot scars are visible only very initially or whenever you taunt your head fully, but within a few days of growth, these scars are almost invisible. Then coming to myth number 3, robotic hair transplant produces very artificial looking results. The results of a hair transplant are highly dependent on the surgeon performing the procedure. That means designing a hairline or designing a transplant is a highly artistic dependent method. Myth number 4, hair transplant done by a robotic technique produces instant results. Nothing can be further from the truth. At the end of the day, robotic or non-robotic, hair transplant is a hair transplant. Whenever a hair transplant is done in a human, on a human head, it always takes time. That is, whenever a hair transplant is done, the hair follicles take up to 3 months just to settle down, during which time the currently growing hair is ejected out, and then the follicle goes into a resting phase and then starts producing new hair from the 3rd month onwards, going on to give you a full result by the end of the year. That is what it takes, whether robotic or non-robotic. If you are considering a hair transplant and are confused about which technique to use, or if you have any more queries, please drop your query in the comment box below and I will be happy to answer them for you.